Thank you. Wow. Zarephath Health Center. 9 years ago, my husband and I started the Zarephath Health Center in the grounds of our church. After a flood, there was a building, and they let us fix it up to start a clinic. Why did we do that? We had a private practice 10 miles away where we were seeing people, and we never enrolled in Medicaid. Medicaid is just the most ridiculous system set up by the government that pays us 10 cents on the dollar. So it costs us more to actually bill for the service than we get back when you pay for people that have to fill in the forms and send it in. So that was just not an option. But yet, we didn't want to abandon the poor. We were Christians. We knew that the Bible said you want to take care of the poor, and we wanted to do it. So we thought, wow, if we could start a clinic on the grounds of our church or near our church, all the volunteers could come and help us there. It wouldn't have to pay any overhead, and therefore they let us do it. So we started a clinic. Well, now we take care of 300 and 400 people per month, and we're only open 12 hours a week. Why are we so efficient? It's because we don't have to do CPT codes, ICD-9 codes, you've heard it all. And the other thing is, we don't have that liability hanging over our head. We found out that the federal government, the Federal Tort Claims Act, does cover us for what we do in the free clinic. And therefore, we can see a patient, we talk to them, we give it our best shot, we can tell what they've got. We give them some medicine, tell them, if you don't get better, just come back. And they do. They come back if they're not better. Now, they have to wait for a while. It's not terribly efficient, but now these are people that don't have any job right now, and they don't have any money, so they do have time, and so they wait. And but they're very, very, very grateful, and therefore they get seen. We've got 2 nurses here that volunteer in the clinic. I tell you, the volunteer nurses, the volunteer staff are the best people. They're just the nicest people to be around. And so I can say that even after 9 years, 6 hours a week, I put in, 6 hours a week, John puts in, it doesn't get old. We're there. We don't mind doing it because the patients are phenomenally grateful. The thing that we found out was that it only costs us $15 per patient visit to do this. We pay for the electricity, we pay for the medicines that we buy, because we're not paying anybody. Everybody's volunteering, but it works. And therefore, I just think it's the most efficient way to take care of people with problems. But there's another thing we get to do. When we have the free clinic and have all these volunteers, the people come with their stories. You find out why they're coming to a free clinic. What happened to them? Did they just lose their job? Are they terrified of their future? Is their house in foreclosure? Are they, is their husband beating the wife? Is there just terrible stuff going on? And there's volunteers there that come alongside them and get that story. And then we have resources for them to go to. It's equivalent to Alcoholics Anonymous in our church, or the other ancillary things that people can use. We have a food pantry across the way. We have clothing. And the people come, and then they're blown away. They say, why in the world are you being so kind to us? Why do you do this? And we get to tell them. We tell them a story of the Good Samaritan right out of the Bible. And they look and they say, wow, well, what church do you go to? And we tell them, well, it's right across the street there. And our church has gone from 150 to 2,000 in the past 9 years. Not only because of that, but because we've got this culture of caring that has just enveloped this church. And so we have the patients that are starting to come to the church, but then they also have the other people who come, they say, I love this church because it's just really doing something, and this is what the Bible tells us to do, and this is a church that's doing it. So the giving has gone from about $5,000 a week to $50,000 a week. It's a huge benefit having a free clinic. So what I want to do is encourage everybody here. You can do this in your area. You could have a clinic by your church or by your community. It doesn't have to be by your synagogue or whatever. But your community could start a free clinic. And as Nora said, we'd start solving the problem. Dr. Leigner has seen the same thing. One thing that we did find, though, that as we started this clinic was it's kind of hard to find doctors to volunteer. Believe it or not, doctors are strapped. It is extremely hard. You heard the malpractice scenario that we deal with. You heard the pressures that the doctors are under. Obstetricians, let me tell you what's happening. Obstetricians in this state are bringing the women up to 8 months and say, we can't deliver your baby. You're going to have to just go to the nearest university hospital, and that's where they'll deliver you, whoever's there, I don't know, nurse practitioner, whatever, somebody will deliver you. Although we're the most highly trained people, we can't do the delivery. Why? Because malpractice insurance is $150,000. We're a new doctor, we can't pay that. And so here you have the most highly trained doctors are not able to do what they're trained to do. How long is that going to last? Who's going to go into obstetrics? And actually, delivering the baby is the most fun part of obstetrics. And don't you want a highly trained physician delivering your baby, or do you want just whoever's there? 99% of the time, the baby's going to come out anyway, and you don't need a highly trained physician. But it's that 1% that you want somebody really highly trained. So it occurred to us, there's a major problem, and we could solve it if we could make a deal with the state. $10 billion we are spending in the Medicaid system. $10 billion. Our whole state budget is $33 billion. Huge. A third of the state budget we're spending on Medicaid that doesn't pay doctors. Who does it pay? It pays people that run the program. It pays Medicaid HMOs. CEOs are coming away with millions of dollars. It pays for these federally qualified health centers that are pretty inefficient compared to our clinics that don't pay the physicians. Ours are the real charity. Theirs are, everybody's kind of highly paid. They really pad the expense accounts. And it's inefficient. So I'm thinking, if we could talk to the state and say, listen, doctors who volunteer 4 hours a week in a free clinic, run by the churches, run by the 10,000 baby boomers that are retiring every day, we could do this in the community, community-based centers. The people would self-identify themselves. No bureaucrat's going to figure out, well, if you qualify or not qualify. Nobody's entitled. Instead, they're coming, they have no money, they need health care, they go to that place to get the care. If we could do that and doctors would volunteer 4 hours a week, we're asking the state to, hey, say, why don't you forget about paying us? Don't worry about that. Forget about the claim forms. Don't worry about that. Would you just cover us for medical malpractice in our private practices, like the physicians who are working in your medical schools, who there's women that have to deliver going there. Those doctors are all covered by the state. Extend that. Every specialty would do it. And 90% of the doctors I talk to, I would do that in a heartbeat. Because you know what? We're doing it already. Just like Dr. Leitner said, it's the halo. The feeling that, you get no respect, even though you really are taking care of people for free. People are not dying in the streets. This would be more efficient. And I want to save the taxpayers a big chunk of that $10 billion that we're really wasting. And think about how the economy would just revive if we could keep that money, keep that tax money in the pockets of the taxpayers, where they could then do things. They could fix up their houses, employ the carpenters, all the other things that would revive the economy. That's the vision we have. Well, somebody else caught the vision. John Tamaki over here, he just knows everybody in this state. Well, every legislator in this state. He knows them all. The senators and the assemblymen. There's 40 senators and there's 80 assemblymen. And John Tamaki has kind of hung around Trenton and has gotten to meet a lot of them. And so when he heard this idea, he just said, this is the right thing to do. We just have to do it. AAPS got behind him, and he started working. And we've met with several senators, assemblymen. We've gotten together with them. And many of them, nobody has said, wow, that's a crummy idea. I don't like it. They'll go, yeah, that would work. They're looking at this Obamacare, and they're looking at having to expand Medicaid, which they know doesn't work. And that terrifies them. So now we've got at least 2 Democrats and at least 3 Republican senators who want to sponsor the bill in New Jersey. And we're calling it the Zarephath Charity Care Act. And John Tamaki thought Zarephath, because nobody knows what it means, that's a good word to use. And like, what is that? Happens to mean, it's a Bible term that means a place of refuge. That's a good name. But we can call it whatever we want. The idea is to have this bill go before the Senate in New Jersey, and it's going to pass. They're all saying this is a great idea. So, and these are senators that are on the health subcommittee and the budget subcommittee, so it's going to move. And but we're waiting for the timing because we want to get really a critical mass so they're not going to be able to turn it down. We're talking with the lieutenant governors, setting up a meeting, different assemblymen. We just keep on building up the ideas, and nobody says, what a bad idea. That's kind of the idea. You've got this card, and njaaps.org is where we'll keep information. But what we want you to do is to think about your community, think about you could solve part of the problem. As I talk to my patients who are retiring, I said, well, what are you going to do? You know, they go, I don't know. I said, how would you like to volunteer in a free clinic? They go, yeah, that sounds like a good idea. So I think we could get a lot of these people, instead of them being part of the problem, let the baby boomers be part of the solution. And I think we can make this happen. Once it happens in New Jersey, it'll spread to the other states. And I think we can slay this beast of the Medicaid system. Then we'll take on Medicare, and I'm not sure how to fix that one yet. But that's my message, and we'll be happy to answer any questions.